The latest word from the CDC on cruising is don't. As Omicron shows no sign of relenting anytime soon, the agency is advising people to avoid cruises, vaccinated or not. Fox 13's Justin Matthews joins us live from the port of Tampa. And this is an industry that was just getting back in the water, so to speak. So what happens now?
Hey, Cynthia. Well, the CDC says 90 cruise ships, or more than 90 cruise ships, rather, are under investigation or observation as a result to COVID-19 cases. So now the agency is telling people to avoid cruise ships altogether, even if you are vaccinated and boosted. If you're planning on going on a cruise anytime soon, the Centers for Disease Control and Prevention want you to think twice and avoid setting sail.
Cruise companies, they have to make money. And, I don't know how they're surviving in this pandemic. I feel bad for them. But ultimately, your health is dependent on yourself and the decisions you make. And you just have to be smart about it, even when it's not convenient and it's not fun.
The CDC's recommendation raises the travel warning for getting on a cruise to the highest level. It pertains to everyone, regardless of your vaccination status.
I understand where the CDC is coming from because you're in such close proximity, being on the ship.
The Cruise Lines International Association issued a statement shortly after the CDC made its recommendation, calling it particularly perplexing, saying in a statement, cruise provides one of the highest levels of demonstrated mitigation against the virus. Cruise ships offer a highly controlled environment with science-backed measures, known testing and vaccination levels far above other venues or modes of transportation and travel. It goes on to say, while we are disappointed and disagree with the decision to single out the cruise industry, the CLIA and our ocean-going cruise line members remain committed to working collaboratively with the CDC in the interest of public health and safety.
Trying to get back to some kind of normalcy, I think it's a little rash that the CDC did take that approach, as opposed to a softer approach. But it's understandable. I can understand both sides of it.
Okay, so it's unclear as to how long this recommendation to avoid cruise ships is going to last. But right now, every cruise ship that comes in and out of U.S. ports is under a conditional sail order where they have to follow certain COVID-19 safety protocols. That, Cynthia, is set to expire on January 15th. So we'll just have to see what happens after that.
Well, exactly, because if people start heeding the warning and they don't have enough paying passengers to go, that could have an impact. So I think you're right. This is going to be a wait and see what happens here. Thank you, Justin.